The importance of rehab nursing at the Memorial Rehab Institute is a top priority. Rehab nurses' purpose is to move patients back to their life. They're coming out of horrible accidents, life-changing events, and they're actually learning here from our rehab nurses and our therapists how to move on their journey of life. And it's very rewarding.
The mentality in rehab is different. So because we're post-acute, our patients are a bit more stable, and the whole goal of them being in inpatient rehab is to kind of gain their independence for whatever that particular patient's level is. And so rehab nurses, we really have to push our patients and support them for those goals.
We have a broad spectrum of patients that come to our unit. Most of the patients, if not all of the patients, are medically complex. They have a primary diagnosis that they come to rehab for, whether they have a stroke, whether they had a spinal cord injury, whether they had an implant, or whether they had cancer. But they also are diabetics. They also have congestive heart failure. They also have a stroke. They have Parkinson's disease. They have memory deficits. And everything combined with their injury that they came to rehab for. We have to include all of our nursing skills to take care of them.
The fact of the matter is, everybody needs rehab. Whether you're here from a transplant, an LVAD, you had COVID, you had pneumonia that really, did a number on you, you're gonna need some sort of rehab, and if they deem you eligible for inpatient rehab, you end up on our unit.
The patient goes to therapy for up to 3 hours a day. The physician sees the patient for about an hour. The nurse is really responsible for overseeing that whole plan for the other 23 hours of the day.
The nurses function in great part as a link between the doctors, the therapists, the kitchen, all the ancillary services, and they make it click. They make it happen.
We are team players. We have to work closely together. We respect the work that the PCs, the kitchen staff, the therapists, everybody comes together to make sure that everything gets working well so that patients can get to therapy and maximize their care and get home as soon as possible.
And I absolutely love it here. The staff is terrific, and the therapy, they work you hard, but that's good. So you can get better, and they make sure you're ready to go home.
They are always upbeat. They are always happy, smiling, which makes it easier for the patient to just feel happy about himself.
The emotional side of it, I feel like that's one of the things that you really get to see and consistently encounter with the patients because they're here for such a long amount of time versus like acute care where they're kind of here for like 3 days, 5 days at most, and then they're gone. We have patients stay here for sometimes over a month. So you really have to be with them and support them and keep them motivated for therapy. And so that one I find to be very rewarding.
That's really the sentiment that I get from most of the patients is the nurses, they gave me my life back. They helped me get on with my life. It's seeing the teamwork, healthcare professionals working together and counting on each other and really making a difference in the lives of the patients. That's success. That's success.